It's been 3 years since the world came in contact with the virus SARS-CoV-2, a virus that shut down activities across countries. As at January 2023, Zamfara State, northwest Nigeria, recorded 357 cases of coronavirus, with one of the least incidence of 9 deaths. Accepting the disease and lockdown measures has been difficult for health workers. Most of them denied it at first.
Nobody knew it was coming, it was not planned for. The people were frightened, everybody's scared. And then the only place to seek for help are the facilities. And then another horrifying issue was that the first victims happens to be the health personnel. And the fact that the signs and symptoms for COVID were very similar to a lot of common illnesses like common colds, malaria, fevers of all sorts and other things. So that makes ordinary patients became abandoned himself because everybody's afraid that maybe if you see a patient after treating him for malaria or common cold or something, the next thing you hear that is COVID-19. So the healthcare workers became apprehensive and do not want to attend to their clients. And then people are also avoiding the facilities.
With the help of vaccines, the world has since opened up to life and commerce. In Nigeria, the vaccination gap among states has narrowed. Authorities say some states have done better than others. With a population of about 9 million, Zamfara State is yet to vaccinate over 1 million out of 2.3 million targeted for COVID-19 vaccination.
We came together and decided to come up with integrated services. Integrating the COVID-19 prevention and treatment alongside all other PHC services. So we integrated the services. If you come for any care, it's been integrated. For example, you came in for, let's say, malaria. We try to use that opportunity. If you come with a child, we give him immunization. If you are requiring childbirth spacing services, we'll give you. If you require antenatal care, we'll not wait to polarize the services such that you come for antenatal care, okay, get your antenatal care and leave. No. We try to integrate all the services in that form, and that's how we have been going, and that's one of the advantages that the COVID-19, apart from the release of funds and services.
The government has integrated the COVID-19 vaccination into other services. How equipped are these facilities, and how many health workers are available to take on the job in a highly religious and now volatile area like Zamfara State?
COVID-19, that's primary health care being the bedrock and also the portal of entry in healthcare delivery services needs to be given a lot of attention, because except that they are equipped to the level to address and identify and address basic things, then even the secondary and tertiary cannot. And we keep saying it that this is why we are still having no bed syndromes in many secondary and tertiary facilities. People need to, especially the politicians, political leaders, needs to be reoriented.
In a bid to ensure transparency and accountability, Connected Development, a not-for-profit organization, has collaborated with other partners to track funds allocated by the government for the COVID-19 response in states.
The SAMC project is a project that was bettered out of ensuring strengthening accountability measures in COVID-19 interventions. We know that during the pandemic and during the lockdown, there were a series of interventions that came into Nigeria based from partners, from well-wishers, friends, and community members per se. And Connected Development has, over the past 2 years, tried to track various projects using its initiative known as I Follow the Money. What we're trying to do this time around is to track how much most of these interventions that were sent in were able to be of good effect to the people, to Nigerians, if people actually benefited from the interventions, down to basic healthcare infrastructure. And majorly, most of our findings have been recorded, and one thing we have noticed over the past 1 year or thereabouts is that most infrastructures were upgraded to be able to accommodate COVID-19 vaccine. I see that as a good development, but even at that, some of these infrastructures just received few things and were not upgraded to continue to be sustainable enough to help community members even after the COVID-19 vaccine.
This initiative is a follow-up to its intervention over the years in local communities in Zamfara state.
And when we are doing the research, I got an opportunity to visit about 90 to 90% of almost all the health facility we go, especially the community. And based on our finding, we found out that the health facility need immediate intervention because some health facility lack manpower, where some even lack a space, some lack ambulance, a lot of challenges. Nobody can stand up and say this is the actual money the state government got during COVID-19, especially support. I know a lot of people make personal donation, some make a contribution in kind, but the state government up to now refuses to tell the public or tell the citizen this is what we can be able to realize as far as the COVID-19 case is concerned.
Health personnel in terror-stricken regions of northern Nigeria are in dire need of all the help they can get to cater to health needs of those in rural communities. Top on that list is the rehabilitation of health clinics, the provision of potable water, and the employment of qualified medical staff. From Anka to Maru, Maradun, Shinkafi, Safi, and Zurmi, bandit attacks in Zamfara state keep depleting medical facilities, draining health workers, and forcing those in rural communities up north to access overstretched health facilities. This is the maternal and child health facility in Maru local government, managed by Amina Abdullahi. For 28 years, she has worked as a health worker at the facility, first as an assistant and now the officer in charge of MCH Maru.
This is maternal and child health clinic Maru. We have at least 18 communities that are under MCH here in Maru, yes. We need your assistance. You help us. We have a lot of women and children that are coming to this facility. Seriously speaking, they seek our help, but we do the only thing that we can. You please help us. When you help us, you help the community, you help the women and children, God will help you.
This is a maternal and child health facility without a delivery room, wards, laboratory, or even a pit latrine to accommodate the number of women who come here in droves for antenatal care and ready-to-use therapeutic foods. When there is an emergency, Amina uses a cycling ambulance to transport patients to the General Hospital, a facility about 2 to 3 kilometers away from town.
We have a lot of lab equipment, but we don't have laboratory. Any woman that wants to deliver here, we just transfer them to General Hospital. We have a lot of women that are coming to our facility, but we don't have enough. We have space, but we don't have wards to help them. So there's nothing we can do. Anyone that is seeking for assistance, we just transfer them to General Hospital. We only conduct ANC here, so we don't have water. Our borehole is condemned. I always, every day, buy water. Drinking water, for hand washing, everything. We don't have borehole, we don't have labor room. We had a lot of equipment, but we don't have wards. We don't have enough rooms. We only have 3 rooms for ANC, family planning, only in CMAM Center only. More than 100 women that are coming for CMAM Center, but we don't have fit latrine. This is a big challenge.
You don't have toilet at all?
We have this one. This one is water carry system. And the women that are coming for, most especially Wednesday, Thursday, that are coming to this facility for RUTF, they can't manage this small solely water carry system toilet. We don't have water. Water carry system runs with a lot of water. They put their children anywhere to do shit. So my major challenge here, we need ward, we need labor room and water. Then pit latrine. That's our major challenge here.
Bringing their child for.
In spite of the challenges Amina Abdullahi faces daily, she tries to vaccinate women and children that come into the facility, her own move to curb the spread of coronavirus, measles, or yellow fever.
Our mothers came here for CMAM to receive RUTF. We used to health educate them on COVID-19. Any woman that is there, we do immunization. As is there, we are conducting COVID-19 vaccination. Any woman that came for RUTF must vaccinate. We must give her COVID-19 vaccination first before I give her RUTF. Any woman that delay or dislike the COVID-19 must go home. I told them the importance of COVID-19 and the importance of my Madara, my RUTF. So I vaccinate their child and I vaccinate the mother with COVID-19. First, the first step is COVID-19, the second one is my Madara, my RUTF. So that's the way we captured a lot of women. In a day, we captured more than 60 women that we vaccinate against COVID-19. So we don't have problem with that. The immunization from Monday to Friday. Every day we did immunization. Any child that comes to us, we vaccinate them. So we don't have any challenge or any measles or yellow fever. We don't have. No report yet. No report that comes to us that this settlement are doing measles. No, we don't have. Because they are always coming to us to vaccinate their children. Even the immigrants are coming for immunization. So we don't have any challenge with immunization. We have a lot of vaccine. Everything we have a lot of vaccine. Cards, syringes, everything we have. So we don't have a challenge with vaccination, Gaskia.
Under Section 11 of the National Health Act 2014, the federal government initiated the Basic Health Care Provision Fund, a fund that will improve access to primary health care. It is meant to provide free minimum primary health care to the poorest and most vulnerable Nigerians through accredited primary health care in each of the 36 states of the Federation and Abuja. According to the National Primary Healthcare Development Agency, the overall aim of the BHCPF is to significantly move Nigeria towards achieving universal health coverage. The fund aims to achieve at least one functional public or private primary health care facility in each political ward. At this facility, 70% of the funds received was used to buy drugs. The remaining 30% is used to maintain the facility, but not enough to renovate the old buildings. At the time the Community Forum crew visited the facility, only 5 persons, including Amina, were on call, with no accommodation for these health workers. The accommodation provided are in worse conditions than the health facility. The rooms are now occupied by those running away from the bandits on the hills of Maru.
When you see it, it's old building this one. But this house is for MCH. It's scattered and no toilet inside. This one, yes, okay. It's for MCH, no toilet, and all the buildings, you can see the buildings. So we want somebody to help and renovate. Even myself, I will stay there to assist. So all the buildings are cracked. So I can't stay with this building that are cracked, gaskiya. It's dangerous. We have only two rooms, this one and that one, yes. 3 months. But they said we should buy medicine and we should take 30%. 30% is 100,000. 100,000, they said we should not build a house. We should not build a house. 100,000 cannot, 100, it's 30%. We used to buy drums, plastic drums for water, mats, and so on. But 100,000 will not renovate a house or build a big pit latrine. So maybe next month I will use that money to start building pit latrine by God's grace.
But do you get it every month?
No, it's quarterly.
But have you been getting every quarter?
Yes.
For this year?
Yes.
You got in March, June?
It's from March in August. August, September, October, November.
But you didn't get January, February?
No. August.
That's just once this year?
Yes. August, September, October. Maybe November or December, maybe they will give us some.
Outside the facility are children, most of them girls, laboring to use the hand pump. These girls fetch from this water pump and then go into town to sell. The remaining they take home to their families. Amina says the water is unsafe for drinking, but the girls have no choice. They want to make some extra cash. The situation is the same at the other facilities visited. Getting potable water is a major challenge. The children spend hours filling the jerry can, calling out to one another when strength fails them. This is the same source of water for the primary health center in Rawaya Bela under Bugundu local government.
Look now, there is one NGO organization which is New Incentive. Before, our people, they are not bringing their child to the hospital for routine immunizations due to the other reasons. But as the time the New Incentive arrived to this state, they have started doing routine immunization. Maybe they are giving them some certain amount that will take them to their various places. Maybe they are far away from the first facility, or they are doing something which may lead them to not come to the hospital. So those certain amount they are giving them, it is maybe emphasize them to come to the hospital for routine immunization. So for this coming of new intensive care, we are getting more development in terms of routine immunization. As you are seeing now, all the clients, they are receiving their immunizations safely. So apart from this, there is also a program of basic health provisional funds. So even this program, they have provided a lot of drugs for us, which we people, we are now giving it as free of charge to the clients if they come to the hospital. So as a result of that, we are getting improvement of getting much client to the hospital. The money they have sent to us is the one we used to go to medical store, state medical store, DMEA, to purchase drugs and come and keep it in our pharmacy for attending patients. So it's that point we are receiving from them, we are maintaining the hospital with it.
So how many communities are you supposed to serve?
So we have at least 22 communities. 22 different catchment areas communities. Maybe it's getting to more than 5,000, over 5,000 people.
One thing is clear. There is support from some non-profit organizations, but the facility needs more interventions.
We have did it several times. Sometimes now we can get maybe some official staff from the Ministry of Health to come and supervise the hospital. So we don't know. They are coming to collect the data. So they say they are coming maybe to enlarge or to rebuild or to rehabilitate. So up to nowadays we have not get any information from them. See our toilet where the clients they used to go and eat their seminar. So it like to be repaired in order to maintain the health of the patient. They are using that places. So this is the building. That building you are seeing is a hospital building, the house of the hospitals. So even the house of the hospital need repairment.
That's the staff.
The staff quarters, so need to repair it because all the building is scattered, and there is equipment we need. In some equipment we need to attending patient, like BP apparatus, our own is damaged, a stethoscope, and thermometer, and weight scale, and different things. And if you go to our laboratory, all our equipment is just minor. Sometimes we people used to provide it to put it in the hospitals. There is emergency cases. If we get emergency cases, if we see the condition is worsening, so we are going to refer that patient to the other maybe secondary or tertiary institution for proper treatment. So that is how we are doing our things here.
How far is the secondary or tertiary institute?
Like General Hospital or Federal Medical Center.
How far is the place to this place?
It's just 15 to 19 kilometers from here to Gusau. So this is where we are doing ANC, antenatal care.
Do people stay here?
They can stay here if the condition warrant. They can stay here. Yes.
Patients don't stay most times.
Yes, they can stay sometimes. But now we don't have admitted patient now. That is why they are not here. It's just
So
only
you use this
outpatient.
place for male and female?
Just both male and female where we are admitting them.
Do you have electricity?
There is electricity, but we have problems with. There are sometimes the fault fell down, so all our wiring don't spoil it. So right now we don't have electricity. For now, there is no electricity. We just have the fan and me, but there is not. It's not working. It's no longer working now.
A ward decorated with cobwebs, mud, and an anthill. No demarcation for male or female patients. Just 4 worn-out mattresses in the general ward and 2 beds in the dark room, also known as the delivery room. There are cracks all over the building.
So that is how we are managing. If you see the patient will take responsibility for leaving this area to the urban area, so it's so difficult to them. So that is how we are managing to attend them like that. This is our pharmacy, and this is our main store. No, we don't have enough manpower. It's only we are just technical staff. We are only 4 in number. Technical staff. We are just 4 in number. 1 volunteer, other hard staff. We have a cold chain office there where we are storing our vaccine. Our vaccine is kept at that places in solar office. So this is how the hospital is located as.
At this center is one of the 147 tricycle ambulances. It is supposed to be equipped with essential equipment to facilitate emergency responses from homes to facilities and support referral of patients from primary health care to secondary facilities. but not much is inside. At Kotarkoshi Primary Health Center, still under Bungudu local government, irregularities and corrupt practices in the health sector jeopardize the hard work of a few health workers on call.
Large catchment population and areas also, though we are reporting 96 settlements under this facility or catchment area. And then we have some other health facilities within the catchment area, like PHC Tadami, PHC Guluba. We have some community dispensaries like Gidan Algo, and then we have PHC, let's say Sabangida also. We are only almost within the catchment population here.
Aliyu takes us through the dilapidated structures, one by one, from the wards to the labs. The walls are cracking up.
No, they need to see crack also, as we have been telling you. It has crack also.
He's worried about the condition patients are in whenever they visit. There are no beds in the wards, so sometimes the patients are outside waiting for care.
You see, even our mattress, if somebody donate with,
somebody
donate this, he was even write his name attached for his efforts. Yeah. See, even our bed, some are even cracked and bent. Then the other mattress is somebody that donates with.
Someone donated the mattress.
Mattress. You even saw his name attached with.
You don't have enough.
We don't have enough safe. Even some beds are even broken. Assalamu alaikum. Sannunku. Ya masu jiki.
In this facility, there are about 46 health workers, but they can't run a 24-hour shift at the hospital. Only a few are on call. The others don't resume for duty. They are just on paper. This is a problem the Zamfara State Primary Healthcare Board is working on. They are hoping to give the health workers salaries based on a performance-based review. Various projects cited at this facility are moribund. The health workers are waiting for the government to implement the policies that will make healthcare more accessible to the people and perhaps profitable for health workers. For the 19 communities attached to this facility, they are hoping the health workers stay the course, even in the face of tempting pastures.